So the top 10 cancer sites among the Filipinos would be the breast. That's the first. Second is lung, as already mentioned a while ago, I think, over the talk this morning. And then the third is liver, surprisingly. The fourth is cervix. And the fifth is colon. 6 would be thyroid, 7 would be rectum, 8 ovaries, 9 prostate, and the 10th is the non-Hodgkin's lymphoma. So that's the statistics as of 2010.
Thank you, Dr. Christine. With over 100 types of cancer, how prepared is the Philippine healthcare? This is for you, Dr. Anaida, in providing quality cancer care. What do prime hospitals like Cardinal Santos provide to make sure that cancer is prevented, detected early, and most importantly, cured? Dr. Anaida?
I will speak for Cardinal Santos Medical Center, of course,
Sure.
because I work here. I think we are more than 100% prepared to take care of cancer patients. More so in this hospital, because now we have the PET-CT, which we just blessed this morning. It makes me proud that I'm part of this organization. What's your second question?
How prepared?
We are
Philippine
more than
healthcare
100% prepared. Okay?
For Cardinal Santos,
Yes.
How prepared is Philippine healthcare to you in providing quality cancer care?
We have all the modalities existing, not just here in Cardinal, but in other hospitals as well. So we would be able to really give excellent care to all our cancer patients.
Thank you, Dr. Anaida. So we would like to get the direction from the President of Cardinal Santos, Attorney Almira, with the installation of this new PET-CT and establishment of cancer facilities in Cardinal. Is Cardinal Santos Medical Center starting to position as a specialty center for cancer center? Can you share with us other plans related to this as far as Cardinal Santos is concerned?
Part of our mission is really to focus on the cancer as a specialty in terms of competence of our hospital here at Cardinal Santos Medical Center, and it is spelled out. It's in our mural downstairs that one of the 4 where we claim we are competent and we are capable is cancer. That's why we have a cancer center that is full-blown. It has all the arrays of modalities to be able to address cancer patients. That's the reason also why our medical director, Dr. Uy, mentioned that we are 100% prepared to cater and provide treatment, healing to cancer patients. With this, we are positioning ourselves to be leading in the treatment of cancer in the Philippines. Not only that, we have very holistic provisions and modalities to be able to diagnose and heal cancer patients with the completion of all the modalities that we have. That is the completion of having a PET-CT in our facility. We can now say that we are pretty much competent in terms of really being holistic in addressing diagnostic, healing, and treatment of cancer patients. Now, given this development that we have at our hospital, we see ourselves as not just a leader to be able to cater to patients who will come to be able to pay, but that we will also be a partner to other facilities in which our capability will be giving value. So if there are other facilities in the healthcare industry that would need other outfits or institutions that will need our expertise, we would be willing to share with them, because at the end of it all, we would like the cost of treatment for cancer patients to go down, to benefit all Filipinos. Now there's something here that we'd like to emphasize. We'd like as well, not just leading cancer center in the Philippines, but a leading cancer center that will also treat marginalized patients who are afflicted with cancer. So here in our hospital, we embrace all patients needing our care. Whatever creed they have, religion, stature in society, social standing, gender, race. We embrace all of them. And it is the mission of our hospital to truly care, most especially to those who have less in life. And this is emanating from the very spirit by which the hospital was founded in 1974 by no less than Cardinal Rufino Santos. We are anchored on truly serving our society, and we are also well-founded and spirited in leveling up the care of cancer in the Philippines. So we're ready to share this, firstly with our own hospital group in the MPIC, and then to the rest of the hospitals. Thank you.
Thank you, Attorney Elvira. May we now hear from Mr. Oji Palisok for a larger scale. Sir, Metro Pacific has long entered into healthcare. Can you share with us the vision behind entering into this industry, and what can Filipino patients look forward to in terms of access to quality care, as far as the MPIC hospital group is concerned?
Yes, sorry, can you repeat the first?
Yes, can you share with us, sir, the vision behind entering into this industry, and what can Filipino patients look forward to in terms of access to quality healthcare?
Well, when the group first ventured into the hospital business, it was some 9 years ago, when one of our major hospitals here in the Philippines ran into financial difficulty, and we basically were able to help that institution to reverse its difficult financial situation, and now it continues to be a thriving hospital. And so with that experience, we thought that perhaps there was an opportunity to do the same for many other hospitals in our country. And that's where the vision of trying to put together a nationwide network of hospitals began. So that was 9 years ago, and at the moment we have a total of 13 hospitals. We're lucky to now be the largest private hospital company in the Philippines, with approximately about 3,000 beds. Moving forward, there are still many areas in the Philippines where we are not present. Of the 13 hospitals, 8 are in Metro Manila and 5 are in the provinces. So you can see that particularly in the provinces, there's still a lot of gaps, and we would like to fill those gaps moving forward, so that indeed we can, in our own small way, try to help uplift the quality of healthcare services in the Philippines. And in that regard, this particular project is probably a living example of that, because until now, I think a lot of our countrymen have had to go abroad, I believe Hong Kong and Singapore in particular, to be able to get this type of diagnostic treatment, the PET-CT. And we have been studying this project actually for the last 5 years. It is also fortunate that one of our key partners in this endeavor, a Korean company called Cardinal, has also taken the bold step of investing in a cyclotron. A cyclotron is the one that produces the raw materials called FDG that is needed for a PET-CT procedure, and that entails a very, very huge investment. So it was necessary for that to happen first before the PET-CT service or industry can grow here in the Philippines. Right now, I think Cardinal Santos is the second private hospital in the Philippines that has a PET-CT at the moment, and so I think with that, again, we are trying to to make available world-class services here in the Philippines so that our countrymen need not go abroad for treatments like this. I think the market still has to be developed and as it will because of the incidences of cancer here in the Philippines. And I think moving forward, our group is also committed to not only grow the hospital network and the healthcare business that we are in, but specifically as well on the cancer side. So a lot of our hospitals right now have cancer capabilities, and there are some that do not. And so we are also looking at introducing those type of products and services in those other hospitals.
Thank you, Sir Oji. May we now hear from our partner from GE. Ivan, one of the most effective ways of combating cancer is early detection. In this day and age, with everything becoming more advanced as before, what are the current technologies available that help early cancer detection? As far as GE is concerned, what is GE's advantage compared to other PET CTs installed in other hospitals in the Philippines? Specifically, the Discovery PET CT 710.
Sure.
Thank you, Ivan.
Dr. Catan. Yes. Actually, of course, the technology that's available here now at Cardinal Santos is the PET CT technology, but there are other technologies, more traditional technologies that have been used prior to the acquisition of the PET CT for cancer diagnosis. This is the traditional CT scan, other modalities like MRI, which Cardinal Santos has been using for many years now. But really the power of having a PET CT is like fusing two modalities into one, right? So a CT scanner and a PET system that gives the healthcare professionals better insight into the state of the patient or the disease. Not only anatomically, which a typical CT scan can do, but also look into the function, right? So fusing those two modalities together gives that power to the healthcare practitioners to give a more specific diagnosis of cancer. What makes GE different? I mean, we're not the only vendor, right, for PET CT. Well, first, we're happy to be partners with the MPIC group, right? And of course, Cardinal Santos is the first site in the group because we are really committed to what we call sustainable healthcare. And as Oji and Attorney Nuka shared earlier, it's about really providing access, right? Access to these technologies to benefit more Filipinos. There are several cancer types that Dr. Grunberg shared earlier. I think it's close to 100,000 cancer cases are actually more than 100,000 in the Philippines every year, right? And it's a pity that for so many years, right, access to gold standard diagnosis for cancer, PET CT scanning was only limited to a very few, and in fact others had to go overseas to get this service. That's I think our alignment with the group in terms of providing access. With the technology that we have, it promises to reduce the overall cost, right, of the diagnosis of cancer, as well as other maybe Dr. Gruenberg can relate more, other specific technologies to our systems, which we call Q-Clear, right? So this is one of the G-exclusive technologies that you will find here in the Discovery 710 PET CT here at Cardinal Santos. It's a quantitative tool, right? That's will aid the doctors to give a very specific diagnosis and be able to more accurately monitor the progress of a patient undergoing treatment, right? So once you're diagnosed, you are supposed to be able to track progress or on the treatment and see if that patient is actually improving or not, right? So this Q-Clear technology, which is a G-exclusive technology, will enable that to happen for our doctors here in Cardinal Santos.
Thank you, Ivan. Early on for the panelists, our media partners, friends from the media, were provided with a kit, a media kit, that contains what a pet city is, how it works, its advantages. So the reason why we invited our panelists is for them to throw you some questions, but they already have a basic knowledge of what a pet cities campus. So thank you to our panelists. Our floor is now open for questions.